So the Africa's Center for Disease Control and Prevention is among organizations calling for a cessation of hostilities in Eastern DRC. Director General Jean Kaseya says the healthcare sector is mostly affected, with infrastructure being destroyed. The DG has described the situation as a ticking time bomb that could lead to the outbreak of diseases.
Currently, what's happening in the eastern part of DRC is not just affecting DRC, not affecting the region, it will affect the whole continent. Goma is a city of 3 million people. Out of the 3 million, 1 million who are displaced people coming from other places to Goma to seek security. With what is going on, let me share with you that we have mpox outbreak, measles outbreak, cholera outbreak in Goma. And for the mpox, we had around 158 people admitted to the center for treatment. Today, only 15 remain. It means we have more than 140 people with flu who decided to leave this place with their disease. They are where we don't know. They can contaminate other people, and we are expecting to have more cases. Don't forget that the mpox clade 1b started in this region. This mpox clade 1b is the reason why I have to declare mpox public health emergency of continental security. Killing children, young people, being sexually transmitted. And you can imagine, now you have more than 142 people out. We don't know where they are. They are contaminating others. And I think this is what is making me very worried.
Now, Director, the issue of infrastructure is quite critical. How will this affect infrastructure also in terms of health services? Because the continent has been trying to rebuild infrastructure and strengthen our capacity based on our experience in relation to COVID-19. Is this a setback?
You are right saying that. Africa CDC provided capacity to a number of countries. Let me remind you that before COVID, we had only 3 countries with the capacity to conduct genomic sequencing. Currently, we have around 27 countries in Africa, thanks to support that Africa CDC provided. But in DRC, we provided support in Kinshasa and in Goma. This laboratory in Goma is keeping even pathogens that can be what we call high-risk pathogens. Then, in addition to that, Goma is known a region facing a lot of outbreaks, but without really having appropriate infrastructures. What we did is already destroyed with these wars and other issues that's happening there. This is why we say we are exposing the continent. Health personnel, they have to fly out of Goma. Infrastructures are destroyed. There is a risk that this laboratory with these pathogens that are there can be out, and we don't know who can use that for which purpose. And to finish, when you have an overcrowded camp, and when you have the density, the population density in Goma today is 39,600 people per square kilometer. It means the highest one in the world. When you take all of that together, it means we are sitting in an area that can be a bomb for the continent.
Have you been able, perhaps as Africa CDC, perhaps through the African Union, to speak to the stakeholders, those who are affected and those who are part of this problem in the region or in the eastern part of the DRC, be it Rwanda, Uganda, South Africa, Malawi, Tanzania, who are part of the troops, including the DRC government, and the M23 rebels. Have you made all stakeholders aware of this time bomb?
I sent a letter through diplomatic channel to all heads of state and government in Africa, all of them, including South Africa, Malawi, DRC, Rwanda, Burundi, all of them.